Very excited to bring you today's episode with a very special guest. But this is your forewarning that we are going to be addressing some very sensitive subjects today, including self-harm. And I don't want anyone to have a negative reaction to hearing some of this information without being properly forewarned. So this is your forewarning, your trigger warning that we are going to be discussing things like PTSD, depression, as well as suicide. Hey, thanks for joining me today on the Laser Therapy Institute podcast. My name is Jason Rountree. I'm a chiropractor and certified medical laser safety officer. I've been working with lasers and their applications in healthcare for over a decade now. And we've spent a good bit of our episodes, which we're well over 100 episodes now, which is pretty cool. We've spent a good bit of our episodes talking about using lasers for depression, anxiety, neurodegenerative disorders. And really, the more we can explore good solutions for those difficult conditions, I think the better. Something that's been getting a lot of attention lately is psychedelics for some of these mental health issues. That is really something that is very far outside of my wheelhouse and what I know much about. But I still think it's really important. It's a really important topic, and the more attention we can bring to it, the better. So joining us today is Tommy Mulhern, and he is a physician associate. He's a Marine Corps vet, and he's an emerging voice in the field of psychedelic-assisted therapy. Now, Tommy and I actually served together in the Marines and recently reconnected over our interests in advancing healthcare in kind of unusual ways, I think. But for Tommy, after many years of working in kind of the conventional, traditional medical roles, he became increasingly aware of healthcare's shortcomings in addressing mental and emotional suffering. And so, guided by his own healing journey and work with ketamine and psilocybin-assisted therapy, he now devotes himself to bridging conventional medicine and natural medicines and helping individuals access deeper and more complete healing while contributing to the growing movement advancing safe and accessible psychedelic care. So, Tommy, thank you very much for taking the time to join us today. I'm really excited to not only get to see you again, because it's been a few years, but also to talk about this really important topic. So just to jump straight in, man, tell the listeners a little bit about kind of your background and your experience with kind of how you got into healthcare in general.
Sure. Yeah. So it actually began when I was in the Marines, deployed on some Navy ships, and you meet a lot of medical personnel from the Navy, and there was quite a few PAs. And so as I was transitioning out, that seemed like a really aligned pathway for me. So. Yeah, also on the introduction, like physician associate, physician assistant, those names are interchangeable. It's increasingly common to see the change. So those are synonymous. I just wanted to make that clear. And it probably will lean more towards physician associate in the next 5 to 10 years here.
I
Uh,
hope so. If not to interrupt you or anything, but I
no,
am
no
so
worries.
tired of several labels, one of them being mid-level. Either you're a
Yeah.
provider or you're not. I hate the mid-level. I've known some just absolute rock star nurse practitioners and PAs
Oh, yeah.
who are, they don't need to be called a mid-level. You
Yeah.
are a provider, right? So I really hope that we're moving away from physician assistant and more towards physician associate. I think it's a really important distinction. And also, we are seeing, like here in Montana, PAs get independent practice after they've had about 4 years of full-time employment. And I
Oh,
think
yeah.
that's phenomenal too. So
Yeah.
sorry to interrupt, but yeah,
No,
agreed.
no. I'm glad you did because I think it's really important. That's why I put that in there. It really, the PA Association is state by state. The legalese around it is a bit odd in each state, but it is really important to like have the population understand like who are providers and who can provide care. Because I do think that perception is really important as you walk into a clinic or a hospital. So yeah, name change there. I think it's for the best. It's going to be a bit bumpy for a while, but that's why I just used it here to hopefully provide a little bit more awareness around it. And going back to how I got into it, yeah, I was coming out of the Marine Corps and I was like, well, what am I going to do with my life? I don't know. I knew these PAs and I didn't have any medical undergrad. And I was like, whoa, like I could go to PA school with my economics undergrad. I had to go get some more prereqs, but it was doable. So Luckily, I was lucky to go to a great school in Chicago, Northwestern, and went and I had a fantastic time there learning and experiencing the clinical education. And then once I started practicing, after a few years, I felt something wasn't aligning with what I believed the system was going to provide to clients, patients. And so I was part of the system that seemed to be very rushed, very focused on how many medications you can prescribe, how many diagnoses you can attach to a chart. And so it was really misaligned with what I wanted to be part of. And along that journey, I myself was struggling after the Marine Corps and found support first through clinical means, traditional conventional means of mental health support, and then I found psilocybin. And it was kind of this combination of my journey and misaligning with the conventional system with then finding psilocybin, the alternative therapy. And I'm like, well, I want to go into this and help bridge the gap between like this Western conventional system and this therapy that's coming out that's been around for decades in the United States, and it's been known about for hundreds of years traditionally. So that's where I find myself now, and I've kind of created my own path, and it feels a lot more aligned with what I believe healing should look like in this country specifically. Um, so yeah, that's why I'm here, and happy to share and educate everyone about what I do.
That's awesome. Yeah, you know, this type of therapy has been getting a lot more attention just in the last few years. I think vets have been good about bringing it up. If you hear other podcasters or you are on YouTube much, you're going to see more and more of this. And I think people have a lot of questions because there's I would say a stigma, a negative stigma involved with some of these therapies. At the same time, there's a lot of hope and maybe a little um, would you say, blowing things out of proportion a little bit as far as expectations? And really, the question becomes, what is going on? We want some straight information on what is real, what is going on with these type of therapies, what are the positives, what are the negatives. So, what is your role right now when it comes to psychedelic assisted therapies?
Yeah, first I want to mention you brought up a really important topic, which is the veteran voice in this country around these therapies. It's really fascinating. What I've witnessed, what I've been a part of is the veteran voice holds a lot of weight, especially in local and federal legislation. And so having these veteran voices that have been to combat, have defended their country voluntarily, and then they come back and they're seeking help and the medical system isn't able to provide it and they have to go out of the country or find healing elsewhere, and then they come out and say like, look, I tried everything that this country could provide for help and it didn't work, and then I found this, like this needs to be accessed by whoever needs it. So the veteran voice is super powerful, and I'm really grateful for those that are putting their time and effort into telling their stories. The stories are extremely powerful, and that's what we all need to do. Um, and to your point around the stigma, yes, it's huge. I hope we can chat about it because there's been like 30 years of silenced um, research and expertise around this, and it's just coming back into the mainstream. This is what people call the third wave of psychedelics in the United States. And so where I'm at now, I am using my clinical education and experience to support risk assessment consultations for those seeking psychedelic therapy. Because psychedelic therapies cannot be the best fit for everybody at a certain time in their life. And so you really want to make sure that you are assessing where you're at with where you're at life situation wise, the medicines that you have on board, the support that you have therapeutically and people in your life. And so what I do is consult with individuals to make sure, hey, is this going to be safe for you to pursue? Whether it's ketamine, psilocybin, or other psychedelics. And I work a lot with nonprofit organizations. The most influential one, I would say, in the space is called Heroic Hearts Project. I've been working with them for many years now. I would say they are the tip of the spear when it comes to um, research, experience, and supporting veterans and their loved ones getting to this therapy. So, highly recommend checking that out if you're a veteran or a spouse of a veteran. And so that's what I do. So it's risk assessment consultations for those going to psychedelic therapies.
Okay. So I guess two different directions I want to go with that. So I want to know more about what that looks like and what you
Sure.
think what you're kind of looking for in those assessments. But first, yeah, let's talk about the stigma side because you know, I think everybody has heard negatives when it comes to psychedelics, and there's probably some people listening right now. This is the first positive thing they've ever heard about
Mm-hmm.
psychedelics, or that psychedelics can even be used in therapy. So, how do we get here? How do we get from, how do we get to the negative side, and then how is it transitioning now? What are you seeing with that?
Yeah, good question. What first that comes up for me after reading about this for many years and understanding it. One, I just want to acknowledge like I don't think there's any blame that should be passed anywhere. We are where we are right now, and all we can do is be here in this moment and move forward. But it is important to understand the history around it because I think it provides really important context around what where we are right now and what we need to do moving forward. So, for example, psychedelics in this country really became big in like mid-century, so like late 1950s, 1960s. And there was really great, like genuine scientific method research being done with LSD and psilocybin. Mainly, that what comes up is LSD being used for alcohol abuse, anxiety, and end of life distress. And there was incredible research being done. And then also with psilocybin at Harvard with Timothy Leary and Richard Albert. And so those things were kind of like up and coming, and it was really promising. Unfortunately, at that time, there was also a bit of the anti-war movement, counterculture, and then the recreational use of those psychedelics. And politically, it became the war on drugs. And then within this country, the government scheduled certain psychedelics as Schedule One, which is really unfortunate because once it goes to Schedule One, then the ability to do research on it goes away, basically. And so Schedule One, for people that don't know, it's this classification where it basically states that there is no therapeutic use and it's high potential for abuse. So what I, put into that category possibly is like cocaine, right? So really not the best medical use and high potential for abuse. Now, what we're finding is that psilocybin is on that list, but it's to me and many people are thinking completely the opposite. It has extremely high potential for therapeutic use and very low potential for abuse. If not, it stops addiction and abuse to other substances. So we're at this paradox, right? And so that is the stigma around it. And a big part of that was also, I don't know if some people may remember the commercial of a frying pan and then the egg gets cracked on the frying pan. It's like, this is your brain on drugs. And so psychedelics, psilocybin, LSD, ketamine were lumped into that. And so, I'm someone that grew up thinking that going into the military, thinking that if I ate mushrooms, that I would end up psychotic and in a mental health institution for the rest of my life. Um, and what I found out a few years ago is that that's not the case. It actually radically positively improved my life. So that is the stigma that we're working with many years, right? That research went on pause for like 30 years and now it's coming back. But we're still in a fight to have these things get to a point where we can study them. The process through federal government is really challenging. And so we want people to learn about this and support it in a way that they think is aligned with their experience. So that's kind of the stigma and where we're at with like kind of stuck in the sand around research a little bit. But things are looking positive in certain categories of psychedelics, ketamine and psilocybin mainly. And so the future is hopeful, I would say. So yeah, that would be my discussion around like the stigma part.
Yeah.
Yeah.
That's I think really important because people need to understand we're not talking about just, unregulated recreational use here. We're talking about intentional use.
Exactly. Good point. Great point.
Yeah.
So, in this sense of it being um, therapeutic, it's not just taking it as you go on a hike or go to a concert, right? What hopefully we'll get into a little bit later is like this actual psychedelic experience, I would say, is probably the least important part of the entire journey that you'll be on. The most important is getting prepared for that and then
Mm,
integrating that to your life, the insights that you gained into your life afterward, day by day, mainly within that month after you use it. So what I think about is like psychedelics is like this little catalyst or drop in the chemical equation that like sparks the opportunity for healing. It
mm.
isn't the healing itself. I hope that makes sense. It's not just because you do this, you're going to be cured or saved. It really is not it's not a panacea or a silver bullet. It's just another opportunity to shift what's going on in your perspective of the world.
It almost sounds like it's an enabler. It's letting your brain heal itself. Is that accurate?
Yeah, well, yes, the ability to heal and create new neural connections is absolutely there, which is some of the most fascinating parts of the research. How I like to describe psychedelic therapy um, is think about you going through your life as if you're skiing down a hill or a mountain on skis, um, and you get into these tracks, right? You keep skiing down the same run every time, um, and you get in these ruts, and your skis stay in the same path, and something happens to you, whether it something that frustrates you, and you respond or react in the same way. That's that same path you're taking on those skis because that's what you've been learned to do, conditioned to do, and environment, nurture nature as you grow up. Psychedelics is like a new snowfall on that run. It gives you this opportunity to choose a new path, go down a different route, hopefully one that, and majority of the time, one that is more aligned with your values and healthier for you. And so that's kind of what psychedelics does, but you're still in control of those skis after that snowfall, right? So it's not a cure. You still need to put in the work, the effort to create those new pathways. Um, the opportunity is there to do it. Your behavior after the experience is what really generates those new connections and new pathways. And then the repetition and practice of those, that's what ends up shifting and transforming your life in a positive direction.
Gotcha. So, for people who are especially very new to this whole idea, you said, this isn't something you just take and then go on a hike. Like everything that goes with it is super critical. If I was new to this particular therapy and I'm just now kind of hearing about it, what are some things you want a patient to know as they prepare to go into this type of therapy?
Yeah, it's a great question. My first recommendation is to um, start becoming more aware of what may be coming up for you personally. If you happen to hear this podcast and you're like, wow, this is like the fourth time I've like heard about ketamine or psilocybin, like I saw it in the newspaper and my friend just talked about it. Be aware of that and maybe take it as a bit of a signal to look into it further. So bringing awareness and understanding of like, wow, this is coming into my life. It may be coming into my life for a reason. And then two, understanding that preparation is really important. Um, a common phrase in this space is set and setting. And so set means your mindset going into it. So preparing your mindset through practices such as it could be different for everybody, whatever aligns with you, but say journaling or yoga, or maybe it's running or meditation. So preparing your mindset so that when you go into this experience, you are amplifying what you want to amplify. Because these psychedelics, they're known as non-specific amplifiers. So let's say if you go in and you prepared yourself to think about your intentions and what you want to work on, it will amplify that and heal that. Now, if you don't and you go into it and all you're thinking about is your buddy that told you about a challenging experience on mushrooms, it may amplify that. So it's really important to prepare your mindset beforehand. Setting is important. So rather than taking it at a concert, to really find a guide or a healing center in the United States, they're available in Oregon and Colorado now. Um, Someone to set up the space and to hold that space for you in a safe, supportive, and loving way. And so those are really important for the experience itself. Um, and then afterwards, the integration part is really important. That is taking what you gain from your experience, whether it's insights, feelings, um, memories, experiences, and taking those and integrating them into your life. So you making meaning for yourself of those things. And then let's say you're like, wow, I should really stop using Zyn pouches. That's the insight you got on this, right? Taking steps to work towards that, right? Like this nicotine is not serving me. I was shown that, like taking steps to remove that from your life. And it takes those little day by day incremental adjustments. And that's the integration. And it's really good to have someone there to keep you accountable, coach you through it, help guide you to make meaning of the insights. So there are that's the really important work around the actual experience itself.
Nice. So you've mentioned a couple of different medications or substances at this point, ketamine, psilocybin, LSD. Um, what are the kind of differences? Where do those apply? Is this something that a patient is going to pursue specifically, or is this something where they're going to rely on somebody's recommendations for what type of substance should be used?
Yeah, great question. I'll briefly go into the types of psychedelics. There's a lot out there, and I'll kind of give a general overview and then into like how client or patient can seek it out. So generally, there's like the classic psychedelics and the non-classic psychedelics. So the classic ones um, are generally natural in origin. So that means not synthetic, not made in the lab. So one of those would be psilocybin. That's most common in the United States. Naturally occurring magic mushroom. LSD is, I would say it's semi-natural, so it's derived from fungus, um, but also made in a lab. So I'd say, yeah, half natural. And then there's other ones that people may have heard of. There's ayahuasca, there's peyote. So those are kind of the classic ones. And for this conversation, probably focusing on like psilocybin mainly, because that's the most readily accessible in the United States and up and coming. And then the non-classics would be those created in a lab. Uh, Main one that comes to mind is ketamine, and that's going to be the main one focused on in the United States. Other one is MDMA, um, classically known as ecstasy, but it has a really important and powerful therapeutic relationship, especially with PTSD. It has been studied quite intensively over the past many, many years. So those are like the non-classic ones. And then around someone finding this, it depends on which one you're looking at. The most common one you can gain access to in the United States is ketamine. Ketamine has been legal since late 50s, early 60s. It's commonly used in surgery. For anesthesia. And then it started to become common in the emergency department for pain. And that's how they determined that it was really good at abating suicidal ideations, like in the emergency setting. So that's the most likely one. And there's a lot of ketamine clinics around the country. You could probably
Mhm.
Google one and find one probably pretty close to where you're at. Um, so that's the most likely one. Not really covered by insurance. There are some, but not a lot. And then uh, the psilocybin access is very limited. It's mainly just allowed in Colorado, sorry, Oregon primarily, and then up and coming in Colorado now, as of this year. And so that's going to be harder to get into, not covered by insurance. You'd have to pay out of pocket, but you can reach out to the healing centers for psilocybin and absolutely find your way into um, that setting for psilocybin. Um, there's also the underground method for psilocybin. It's been legal in Colorado since 2022, so you could find someone that has been doing this um, for many years, and they could guide you in the experience, and that would be out of the regulated system, and it's still legal. And it's also in Oregon as well. So I hope that is a bit clearer, and I can explain that a bit further if you think that's needed. But those are kind of the two main ways to access it in the United States.
Got it. Yeah. I Yeah, there's of course there can be a million things we can talk about off of those, but um, let's move to, we're talking about starting to access, right, these types of treatments, and your role is really in screening, right, and selecting these patients and making sure that this is something that is appropriate, right?
Sure.
Tell me a little bit more about what that looks like for you, what you're doing, and how that helps this whole process.
Sure. And one other thing I want to mention on access, there are a lot of there, as we spoke about, a lot of research going on. So if you happen to be interested, you could
Mm,
research online a clinical study for, say, psilocybin or ketamine or whichever one that calls to you. You might be a candidate for that study, and that's a way to access it as well. So just wanted to follow up on that. Um,
nice.
Now, what I do, so just to clarify, I don't go out and find someone and say like, "Oh, you're a good fit." They come to me, right? They're
Mhm.
interested and they say, "Hey, I want to pursue ketamine." Okay, great. Or I want to pursue psilocybin. Or they don't know and they're just like, "Hey, I don't know what I want to pursue, but I just feel called to go down this path." That's when they'll get in touch with me, whether it's through the organizations I work with or um, just networking. And clients come to me and we set up a meeting to chat and discuss wherever they're at in their path, whether that's I don't know anything about this and I need help deciding, or I just signed up for a psilocybin session with a underground guide in Colorado who I trust, but I just want to make sure I'm safe and I need a medical screening. Can you do that? So it really kind of spans quite a range on where people will come to me from. But really, they will contact me, we'll chat, and um, likely set up a time to go more in depth and talk about their medical health history, any medications that they're on, previous psychedelic use, mental health history, family history, specifically around mental health, and then also what's included in these screenings and what I believe should be if you're out there and you find someone else is a real good discussion around where you're at in your life situation, the intentions for seeking this out. So it's really important to have good support, whether that's your living situation, having a therapist or a psychiatrist that you connect with and can get in touch with pretty quickly if you need support. Family, friends, like who's there to support you if you're having a really challenging time. Um, how's work going? Is financial issues a stress, right? Home life a stress? Is home unstable? Doesn't feel good? Like those are the things you want to take into consideration because there can be some really big shifts as you go through this process. And the last thing you want is to have a big shift and then all of a sudden you have to go back to a uncomfortable, unsafe living situation because going back to the integration piece, you want to have every opportunity to make those new paths in that new snowfall. And if you go back to a challenging space, um, unfortunately, you may end up going down those same paths as before. So that's what I do. And yeah, I found that it's really helpful for individuals to come and chat with me at any point of their journey. And yeah, that's the core of my work.
It actually sounds like a really critical step.
Really?
Especially well, and maybe even if some for somebody who's had extensive experience with psychedelics, but certainly for somebody who is new to it or who is concerned about their outcomes, with something as significant as PTSD and suicidal ideation, um, these are these are serious issues. And doing this the right way, in a way that really benefits you well, it makes so much sense to me that starting out well, like you just described, and then following through with that integration process is absolutely critical to actually being successful here. So,
Yeah,
yeah.
this is the distinction I like to make between, unfortunately, where we find ourselves in this culture, society, and medical system of, well, just give me a pill and fix it, right? Like, hey, let me just like take this and I don't want to do anything else. Unfortunately, the deepest healing, the most influential, goes to the root cause, and that's usually not the easiest path. Long-term healing usually takes dedication, effort, intention towards the root cause. And so for this, we don't want to continue down the road of conventional Western medical care, which is covering up symptoms usually,
Mhm.
and not addressing the root cause. This is trying to get at the root cause. And it takes dedication, intention, and work. Um, and it's really self work. And so it's not just, hey, let me just get to the psilocybin retreat and everything will be better. Going into that with that intention, like you will be let down. And so, yeah, it's really important to be patient, and not think like, hey, I'm going to get a prescription and go pick it up at the pharmacy next week and everything's going to be good. This takes patience and practice. And it's really important to speak with someone that has some experience in this area before you go off, and do it because it that will make the most impact compared to, oh, I just got some handful at a concert, right? Um, so yeah, that's why it's really important the front and back end of the actual experience to take time and focus on, is this good for me at this moment? That doesn't mean you're totally, if it's not at that moment, it doesn't mean you're never going to do it. It just means like, hey, just not a good time right now. Let's
Mhm.
get you ready,
Mhm.
and set things up and support you so that when you actually have the experience, you come out and you can make those new neural connections and your life can be transformed.
Yeah, I think that's pretty great. We've talked about PTSD as one of the conditions that this is being used for. What other conditions are you seeing people interested in psychedelic assisted therapies for? PTSD obviously is probably the most commonly talked about one, I would think. But what else are people seeing success with?
Yeah, there's quite a few, and it really, I would say, um, depends on the condition and like what medicine would kind of maybe be the best fit for that. So, for example, let's say you have really strong suicidal ideations or intentions, right? It may not be best to like go into a psilocybin session pretty quickly, right? What you'd want is to make sure you have support from therapists, family, friends, and then ketamine may be a good first choice there. It is shown to have really beneficial impact to suicidal ideations and intentions. So that is one that I would think about. The other is like major depressive disorder. If that's something an individual is struggling with, um, ketamine or psilocybin could be helpful. I think um, psilocybin could be a longer lasting impact for that condition. Um, and that commonly in this country, it's after you've tried probably some conventional treatment, so like treatment resistant depression. Um,
Mhm.
One notable one that the research has focused on at Johns Hopkins in the past was end of life anxiety or existential distress. So those that are diagnosed with a terminal illness. Wow, the research and the stories behind that, extremely powerful. And then going along the lines of existential distress, for someone that may be feeling stuck, not really knowing where to go with purpose or fulfillment or certain existential things or theories that are going on or trends that are going on with them in their life, they just feel stuck. Psilocybin may be a good option to look into, especially if you can be a bit more patient and prepare before going to therapy. And then just kind of to talk about some really other important conditions that are treated is alcohol use disorder,
Mhm.
tobacco cessation. Wow, the studies on that is incredible with psilocybin and the decrease in alcohol abuse or tobacco use. Pretty impressive. So those are other ones that I think about. Yeah.
That's awesome. What about opioid use disorder?
Oh,
Is that
yeah.
is that there too? Okay.
Great question. I would say when I think of opioid use disorder, it goes mainly towards this psychedelic called ibogaine or iboga. I didn't mention it yet. That's one that it's one of the more intense ones. It is derived from the root of an African shrub and been used for generations there. And so that has shown to be extremely beneficial for opioid use disorder. Many individuals, so it's not legal in the United States. So this is another case of like those individuals that unfortunately were victims of the opioid epidemic, right? Like this country unfortunately created a situation where people with no fault of their own, they became reliant on opioids, but our treatment for that um, ironically, is to give them small doses of opioids every day, right? And they're like locked into this Suboxone life. So it's, yeah, it's a paradox of like what we're treating that with. Ibogaine has been shown to be very beneficial. Unfortunately, you have to go out of the country. Um, you have to leave the country to go use it. Um, and so it's just kind of backwards that our citizens that are struggling with it have to leave the country to go get therapy. But it's been shown to like positively transform their lives and curb the um, reliance almost immediately. That's not to say it's not with hard work, right? Coming off of opioids is challenging. You really need to have a good taper of the opioids, and then ibogaine isn't for everybody. It's really strong or intense on the cardiac system. So, like any issues with the heart, you have to be very careful with it. But that's not to say it's still useful. You should be monitored on an EKG when you go through that experience. If you find some place that doesn't do that, don't go there. And so yeah, opioid addiction, I would pair with ibogaine. And there's been some hope out of all the states in the country. Kentucky has had some pretty um, positive movement towards that, as well as Texas. So who knows? It may be an option here in some cities in the country in the future.
That's Excellent info. We're talking about serious health conditions. I think this is a good time to remind anybody listening that Tommy and I are both healthcare providers, but we are not your healthcare provider. And the things we're talking about now are educational. They are to help you in your health journey. This is not to say that anyone listening is a specific candidate for these therapies, but certainly if you know more about them, then you know that maybe it is time to talk to somebody like Tommy, and find out more about this and more about you and whether this would even be an option for you in your situation, because it sounds to me like there are multiple different approaches for individuals, and dealing with these really serious conditions. And again, to remind people too, not everybody's case is the same. Not everybody's PTSD is the same and responds the same way. Not everything is going to work for everyone, but many times you need all hands on deck with these kinds of mental health issues because they can be extremely severe. They can get out of hand really quick. And so multiple lines of treatment are often good. We've talked a lot about therapy. We've talked a lot about just kind of the traditional approach, as well as some of these psychedelic assisted approaches. We've talked on this show too about laser therapy for the brain directly to help with things as diverse as depression, major depressive disorder, as well as opioid addiction. And I think this is one where really knowing more about this whole situation is going to increase a patient's chances of success. And that's really a big part of why we're doing this today. So, Tommy, I know we're going to have some people that are interested in talking with you or scheduling a consultation with you. This platform reaches a good number of healthcare providers who can also share your info because, like me, we see a lot of people with these disorders, and maybe I'm working on their arthritic knee pain or their back pain. I don't have a lot of tools necessarily to work for their PTSD, and so if we want to connect our patients with you, or if we're a patient looking to connect with you, it sounds like email is probably the best route to just get a hold of you directly. Tommy's email is macrodosemarine@gmail.com, which is just a baller email address. I love it. We'll include links to Tommy's website as well as that email address in the show notes. But if I can just encourage listeners to seriously consider this for those difficult cases, of mental health cases, and do it the right way. Tommy talked a lot today about making sure that somebody is in a good place to actually do this and benefit from it, and not just cowboying it and trying to figure it out on your own. It's not a good fit. So please, if you have questions, you can get a hold of us here, info@lasertherapyinstitute.org, or get a hold of Tommy directly. Tommy, anything else in closing?
I would just like to say you bring up a good point about those who may listen to this podcast, providers. Um, I recommend, if you think this may help someone, direct experience, do some research. I'd happy to provide that if you reach out to me. And if you feel called to explore this as well, yeah, take that step. And then in this space, it's uncommonly a direct referral, right? A lot of times you'll have providers that are just like, man, I've been working with this client for a while and they're really struggling and they tried all this stuff and something in your heart or gut tells you like maybe I should just say, yeah, have you ever thought about the psychedelic therapy up and coming, right? Doesn't need to be a direct referral, maybe just planting a seed, and then sending it my way or whatever way feels most supportive for you and that client at the time. And then for the clients out there, as Jason just said, like everybody's on their own journey and their own path, and there's not one answer for every condition, right? It is different for everybody. So just know that, be patient with yourself, and just because your neighbor went a certain way doesn't mean that you have to go that way as well for you. And in closing, I just really want to say thank you, Jason, for the time here, and being able to connect and share my story. And I really, for the first time since probably the Marine Corps, have been passionate about something, and it's really educating and informing people about the positive outcomes of this type of work and therapy. So thank you for the platform, and I wish you all the best. And um, yeah, this has been really great, and I hope we can reconnect in the future, talk more.
Sounds great, man. Thank you again very much. And we'll drop those links in the show notes so you can get a hold of Tommy, get a hold of us if you have any questions.
Thank you.
Subscribe now to keep learning about the growing field of laser therapy. Check out our patient-focused podcast, Healing at the Speed of Light, a great resource for your patients. For massive practice growth and improved patient outcomes, become a certified Laser Therapy Institute clinic. Learn how at lasertherapyinstitute.org.